Demand, if anything, keeps growing because what you're seeing now, and a lot of this has to do with these mid to large size groups that have changed their practice model. They've gone away from a hospital-based model in the past 5 to 10 years, probably, where it's become more of a national type presence of changing their business model and running like a corporation and not like a old private hospital, where losses could be had, and somebody, whether it be if it was a state hospital or if it was a private hospital, endowment took care of it, or the state paid for this and stuff like that. Not anymore. These places run like a Fortune 500 company. They expect profit. They expect their shareholders to be making money. A lot of private equity involved with a lot of these large practice groups, and as a result, they have bills to pay. When they have bills to pay, they want quality candidates, and they want people that they can trust, and people that will be large producers for them. That's what it is. It's these places. They don't operate like what I trained in before. That's for sure.
I mean,
I trained in those times. Hospitals couldn't make money. They were, and that's why, and that's a big part of why I gear partners towards certain specialties or certain niches of development, because I do know what are the more profitable areas in medicine. There's a lot of not profitable areas in medicine you want to stay out of. If a large group, and what you're seeing now is changes in group models, medical group models, where a nurse practitioner or a physician assistant will cost a group about a third of what they'd invest in a physician. So obviously, by employing 2 physician assistants or nurse practitioners to basically do the work of 1 physician is far more lucrative for the group. So what they do, as long as they have a nurse practitioner on site, and this is a little bit of the difference between the nurse practitioner and the physician assistant. A nurse practitioner, both are able to see their patients on their own. However, from a credentialing standpoint and a CARF accreditation standpoint, a nurse practitioner carries more weight as far as being there on their own, having more autonomy and independence within the group. So if you have a physician that's in and out of multiple practices or multiple practice locations, he can have that nurse practitioner doing his work for him while he's at 3 other sites doing procedures or something like that, which generates more money for the group.